All right. Well, thank you so much, Damien. I am so excited to be here with you all today and talk about a topic that is extremely important to me, and that's the Black experience. So I hope everybody gets something out of the session today, and we are going to hop to it. Let's go. All right, first slide. Okay. So, when we talk about multiple sclerosis, let's just start with a definition, right? So, I'm first, so I get to kind of set things up for all the rest of the speakers that are going to be talking to you further along in the program this afternoon and for the rest of this week. So, let's just kind of set up with a definition. What is MS? And that's a question that many people ask me. It is what we consider an autoimmune disease, meaning the immune system, the part of the body that normally attacks viruses and bacteria, gets confused and for some reason attacks a good part of the body. The reason that I like this particular picture is because it is a nice graphic that tries to illustrate the myelin. So the part of the body that's attacked is myelin, or the coating of the nerves, and it works like insulation in a wire. And I like to use the example of my little cordless headphones, because if something happens and gets damaged with the wire or the coating of my headphones, then they won't work like they're supposed to. And depending on how severe the damage is, they may not work at all. And so we can see on this graphic, we can see to the far side, we can see the nerve fiber that looks normal and has a nice fatty coating on it. But we can see on the second fiber, the one closest to the picture of the brain, we can see that there's some damage and that there is removal of that myelin. And depending on where the damage occurs is what results in the symptoms that we see related to multiple sclerosis. Next slide. But more than just being a technical definition, MS is so much more about people. It not only affects different parts of the body, but it affects people's lives. It affects their families. So the effects of MS are much more far reaching than just a technical medical definition. And so I like this picture because it illustrates, that there is a community involved in MS and that all these little words make up MS, but there's so much more than just the medical piece to it. Next slide. Okay, so when we think about the face of MS, one of the biggest questions is who gets MS? So, why is a discussion like this even important? Why is having a summit like this important? Because traditionally, when most people have thought of MS, this is the face that's come to mind. It's the face of a young white woman, a woman of Northern European descent. And although we'll talk a little bit later about some of the statistics, when we look around the world, although that is still one of the most common faces that's seen, when we think about MS here in the US, obviously there are a lot of different faces and a lot of different people from different backgrounds that develop MS. And so the face of MS is actually changing. And so it is great to see some of that represented and to see us being able to talk about these issues, especially as it pertains to the Black community in summits like this. Next slide. All right, so looking at the prevalence of MS around the world. So if we look to the far top right, we can see that the highest prevalence of MS is still in Europe, right? So we can see the numbers are pretty high there. We can see that the numbers in North America are pretty similar to some of the numbers in the rest of Europe. But when we look at, let's say, Africa, we can see that the numbers are extremely, extremely small. And that can be for a variety of reasons, but every time I get ready to gear up to do a talk about MS in the Black community, I look up the data, and there's just not a lot of data about MS in continental Africa. Next slide. All right. And then what about multiple sclerosis in the United States? So, again, we know that over 1 million people, thanks to the MS Society and the work that was done with the Prevalence Study in 2019, we now know that nearly 1 million people in the United States have MS, which is actually double what we previously thought. So, not only is MS more prevalent, but we're finding that it's more prevalent in different populations than we originally thought as well. Next slide. So when we think about the incidence or the occurrence of MS by ethnicity, we can see that MS actually is highest from these studies in the Black population here in the US. Now, again, remember, worldwide, it's still primarily a disease that's seen most commonly in Northern Europe, but certainly here in the US, when we look at our population, we can see that green bar is telling us that MS is actually most prevalent in African Americans, and that is more driven by women. So we can look at the bar graph in the middle, which is showing the difference in the incidence in women, and we can see that Black women have a much higher incidence of MS than white women. When we look at the graph next to it that shows men, we can see that the men have a little bit higher incidence, but we see that it's primarily driven by women. Next slide. Which brings us to the other statistic that was really shocking. So in the past 10 years, there's been research that suggests that Black women are up to 47% higher risk for developing MS than their white counterparts. So this is why summits like this are important to talk about this information. And also many of us in the MS community are working on collaborations to try to understand why we're seeing this increased risk and why we're seeing some of the outcomes that we're going to talk about a little later on in the talk. Next slide. So back to the prevalence of MS in Africa, all right? Now, when we talk about actual cases, if you look at the medical literature, which I said I do every year when I gear up to get ready for these talks, there's very little literature, and there are only about there are less than 10 cases or case reports that have been reported of Black people in Africa with MS. And so, again, some of that may be due to access to care. Some of that may be due to, scarcity of neurologists. But even in those areas where people are going to hospitals and being diagnosed, certainly we're not seeing a lot of MS. So that brings to the question, why are we seeing it more in the US population? Next slide. All right. So what does it mean to be Black, right? And so this is one of the issues. So when we talk about race is actually kind of a social construct. But when we talk about ethnicity, like where people are from or where their countries of origin are from, it's a little more difficult when you're talking about the US Black population, and so one of the difficulties is that how do we know someone is Black? Because they tell us, right? So we just had someone else in the news who said they were Black and they were working as a Black person and had a tan, and they were absolutely not Black, right? So there's no way really for us to tell. And so we have to begin, for us in the scientific community, to try to define things on a more genetic or cellular level rather than just looking at people's characteristics to determine, and one of the difficulties is that every time someone identifies as Black, it's just by self-identification. And what does it mean to be Black? That certainly can mean for Americans, African descendants of Americans, descendants of slaves, right? Certainly that could mean people who are from Europe, right? Afro-Europeans, people who are African immigrants. And so there are a lot of different backgrounds that are mixed in, which makes the definition sometimes a little bit difficult. Next slide. And when we look at it on a genetic level, African descendants of slaves, or American descendants of slaves at least, have roughly about 80% African genes and about 20% European. And so there's some question if that mixture of genes is actually what leads to the increased risk and also possibly the increased severity of MS that we see in the Black US population. Next slide. All right. So what are some of the clinical characteristics? So there was a seminal paper that was released in 2004 that really was the first one to try to give us information about how MS behaves in the Black American population. And so what were some of the things that were seen? Number one, it seemed like the actual proportions of subtypes of MS were very similar. So, we usually say about 85% of folks with MS will start off with relapsing remitting. About half of those will go on to develop secondary progressive. About 10 to 15% are primary progressive. So if we look at those subtypes in those populations, they were similar. So it wasn't necessarily that Black people had more progressive MS, but certainly, that was one of the questions that we would consider when thinking about why we see more aggressive disease. So we did see a more aggressive course of disease in the Black population. There was a shorter time to walking disability. Some studies suggest 6 to 10 years earlier than our white counterparts, meaning people need some use of a cane or a walker significantly earlier. And then also people had more optic neuritis, which is a problem with damage to the optic nerve, which can cause visual loss. And there was poorer recovery from visual loss from this particular study. Next slide. When we look at other more recent data, it still suggests that in some people there's a more aggressive course of MS. So more MRI lesions, potentially more atrophy or shrinkage of the brain, and then certainly particularly more shrinkage in areas of the brain that may affect cognition or thinking. And so of all the literature that we have, much of it suggests that there may be more severe disease in the Black population. Next slide. Okay. And why don't we go, can we go to the next slide and then we'll come back to this one? Okay, so when we look at this graphic, I like this picture because it gives us a better kind of view of mortality. So one of the things that we talk about with MS is that generally MS only shortens the lifespan very minimally. So most people with MS live a pretty full lifespan. But I thought this was an interesting study that was published last year that suggested that when we look at mortality, meaning people who died and their primary cause of death was listed as multiple sclerosis, if we look at the overall curve, overall, white people were the largest amount of people who died related to MS, which is what we would expect. Okay. But when you look at the curve earlier on, right? So if you look between the ages of 25, so the bottom row tells us the ages, but when you look somewhere between the ages of 25 and 40 or 45, we can see that that curve is higher in who? The Black population, right? And so that again suggests that there may be more severe disease earlier on that is causing people to die earlier. And can we go back to that last slide? Okay, perfect. All right, and so this slide is just kind of detailing that information. So looking at MS as the primary cause of mortality, we saw that white people, of course, were the largest population overall, but earlier on, there were more African Americans or more Black people that died early of MS, which may mean there's more burden of disease or more disability earlier on that's leading to those outcomes. Next slide. All right, and what about access to care? One of the biggest questions is when we look at these outcomes, is it more related to actual biology? Like, is MS different biologically in Black people, or is it more social determinants of health, right? Are people not able to get to the doctor? Are people not getting diagnosed early enough? Are people not getting on appropriate treatment or having appropriate adjustments to their regimen? And the honest answer is probably both. So when you look at a study like this that talks about access to care and utilization, this is in overall neurologic care in the United States. We can see that Black people are 30% less likely to see a neurologist, and that's for all neurologic problems, whether it's MS, stroke, etc. Unfortunately, there was another study that I used to put up that was published in 2008 that looked particularly at the MS population and healthcare utilization. And it's also suggested that significantly less Black people were able to see a neurologist to take care of their MS. So there is definitely some work that needs to be done in this area, as well as in terms of increasing access to care. Next slide. This was a paper that I had the opportunity to help publish back in 2015. And so what we did was we did a literature review looking at the literature concerning Black people with MS and the literature concerning Hispanic and Latinx people with MS. And what we found was that out of thousands and thousands, right? Close to 60,000 articles that were written about MS in English. A little over 100 were just written about African Americans. And so we can see the disconnect here, right? So we have this evidence that suggests that there may be more severe disease, there may be increased risk, there may be higher mortality earlier. But when we look at the information that's available, it's almost non-existent. And so that was back in 2013. Certainly the numbers have increased since this article was published, but it's still less than 1% of the literature. So we have a lot of work to do in the scientific community to help understand MS in the Black population. Next slide. All right, so what are some of the factors that may be affecting the care of Black people with MS? So there are many, right? So certainly if we talk about, social determinants of health, let's say access to care, even things like transportation, childcare, things so you can attend your visits, right? We talk about distrust of the healthcare system, right? There are a lot of injustices that have occurred um, to Black people here in the US that may make some people distrustful of the healthcare system, and that may also have issues with access to care. Another piece that's very important that we just discussed was that there is poor enrollment in clinical trials. So when we talk about our clinical trials, which are the large studies that give us a lot of information about how MS behaves in populations, how our medications affect folks, and even about the natural history of MS, because there are very few people enrolled in trials, it's difficult to know if the medications have the same side effects in every group, if they work equally as well. And so there are a lot of these issues. And the other issue that I may have neglected to put in there was implicit bias, right? So there is discrimination and implicit bias within the healthcare system that may lead to delayed diagnosis as well as adjustments or inappropriate or adjustments in treatment. Next slide. All right. So we talked a little bit about the science. We talked a little bit about the research. Now let's talk a little bit about what you can do. One of my favorite phrases that I tell all of my patients is that there's a part that you play and there's a part that medicine plays. And there is no medicine that completely gets rid of the part that you play in improving your overall health so that you can live well with MS. So I like to spend a lot of time focusing on things like diet, exercise, to talk about how these things are so impactful and important to your overall health with MS. And this was a study that was published not too long ago that looked at physical activity. And so we know that physical activity is very good for MS. A little bit of exercise goes a long way in terms of helping many of the different symptoms of MS and helping actually your overall well-being. So, exercise is not only good for cardiovascular health, but exercise is good for MS in terms that it can improve symptoms like fatigue. It can also improve mood if people have depression. It can kind of help improve that. Also, if you have any problems being stopped up, I hope nobody's eating lunch, but if you have any problems with constipation or being stopped up, exercise can also help with regulating bowel movements, right? And bowel activity can decrease constipation and also can help with symptoms like spasticity and muscle weakness. So many broad different effects of exercise. And this study suggested that Black people were a little less physically active than Caucasians with MS. So again, it's important for us to do the things that we need to do in terms of checking up with our doctor and following up, but also it's important to exercise and take care of our overall health so that we can live well. Next slide. So you are your own best advocate. So one of the biggest questions that people ask me is, what can I do to help myself with MS? Are there foods I should be eating? Are there things that I could be doing? And so this is a great list that I like to tell people about to kind of get them started with improving their health with MS. So the first thing is to learn about your diagnosis, right? Knowing is half the battle. Anybody watch G.I. Joe? I used to watch G.I. Joe when I was a kid. But so they used to have this saying at the end that says, knowing is half the battle, right? So it's important to know about your diagnosis. There are great resources at the MS Society website, and there are many advocates who will be on talking about some of the things that they're doing. And so there are a lot of great resources to get good information about your MS so that when you go to the doctor, you can ask educated questions and you can be prepared for your visits. So learn about your diagnosis, know about your treatment and what your treatment is for and what it's supposed to do. Okay. Other things that you can do are to incorporate a healthy diet and exercise into your daily regimen, right? So what does that look like? That's a little bit different for each person. So a healthy diet, I have many different patients who do a variety of different diets. Some people do paleo diet, some people do Wahls protocol, some people do Mediterranean diet, some people do intermittent fasting. If you have any questions or concerns, you can talk to your doctor and maybe they can put you in touch with a dietitian or a nutritionist who can help you to craft a diet for yourself. But my general rule of thumb is that probably 8 times out of 10, when we get ready to put it in our mouths, we know if we should be eating it or not, right? Like that brownie I ate yesterday, or that, apple pie you ate yesterday, you know if you should be eating it or not. And so that can be kind of a rule of thumb, but certainly eating more fresh, raw vegetables, raw foods, and less processed foods is a good rule of thumb. Another thing that you can do is tell your healthcare provider if you're having issues, right? So it's important not just to kind of get diagnosed and get started, but to do regular follow ups to see how you're doing, because the treatment may need to be adjusted over time. So I encourage my patients to write down a list of things that have been going on with them throughout the, I guess, months between their visits. I also encourage them to bring a list of questions when they come to their doctor's visits. It's okay to prepare for your visits. It's okay to ask questions. That's what we're here for. So it's important to make sure that you're asking those questions if you don't understand, and that if you're having issues, you let someone know so that they can tell you the best course of action, so that you're not just out there and not getting the appropriate treatment. And then other things that you can do are to develop a good support system. And so this is extremely important, because just like we talk about it taking a village to take care of a child, sometimes it takes a village to care for someone with MS, because not only are you affected, your family members are affected, other people are affected. And so it's important to have family members that can help you, or friends, because sometimes, number one, they can help remind you to stay on track. But number two, I often encourage people to bring their family members and friends to visits, because they are what I call truth tellers, right? So I will often have a husband that's sitting there and I'm like, hey, Mr. So-and-so, how you doing? He's like, fine. And his wife is like, no, we're not fine, right? And it's not that people want to tell on you or say bad things about you, but oftentimes they may see things or have insight to how you may be feeling or how you may be behaving, and things that you may have forgotten about. And so oftentimes they can really, really help inform care when they give us that additional information about how you're doing at home. All right. And then finally, one of my favorite things is make sure you ask for help when you need it. This is extremely, extremely important. And I especially tell this to my ladies, especially my Black ladies. We often have our superhero capes on, and sometimes we have to take our superhero capes off and recognize that it's okay to need help. It's okay to ask for help. And it's okay to get help when you need it. So many times, many of us who are very busy with our lives are caring for other people, children, friends, other folks, parents, etc. But it's okay to take time to do that self-care. And I like this picture of the young woman doing yoga, because I'm a huge proponent of yoga and meditation. It makes life great. All right, next slide. Okay. Now, brain health. What can we do to maintain brain health? Again, this is extremely important. And the things that we do to maintain brain health are the same things that we do to maintain our overall health. So making sure that we're getting exercise, that we're eating a healthy diet, stopping smoking if we're smoking, because that not only can increase the risk for MS, it can worsen the course for MS, and it can also speed up the transition from relapsing MS to secondary progressive MS. Limiting alcohol intake is also important because of symptoms, and certainly does not necessarily cause relapses if people are taking alcohol in, but certainly if there are symptoms like difficulty with coordination or slurred speech, it can make those things a little bit worse. Next slide. So, what kind of cool things are going on in the MS community to try to address some of these issues that we've talked about? I'm going to talk about 3 things, and then we're going to wrap it up. So the first thing I want to briefly talk about is the MS Minority Research Engagement Partnership Network. I forgot the word network on this slide. So this is a really amazing initiative that I am lucky to be a part of, that formed about 3 or 4 years ago. And it was really a group of people from advocacy groups, the representatives from the MS Society, from the Accelerated Cure Project, many of our industry partners, their doctors, their researchers, their patients with MS. And really the goal was, how can we increase education about research, and how can we get people more involved in clinical research? in the minority MS community. And so we were able to get some funding for a research project where we developed a couple of toolkits for patients and for providers to help understand the kind of cultural competency and understand clinical trials. And we actually were able to develop a series of programs called myth busting programs, where we were able to talk to people and do kind of informal discussions about clinical research and what were some of the hesitancies and some of the pros and cons of clinical research. Next slide. And we have NAMSAR, which I'm super, super excited about, the National African Americans with MS Registry. And so this just rolled out within the past couple of weeks. And so it is a national registry where we're trying to gain information about MS in the Black population. And one of the cool things I like as a founding member is that we really wanted to focus on, so it involves questionnaires. So if you go to that website, you can learn more information and sign up. But it really just is trying to gain information about risk factors for MS in the Black population. What are some of the patterns of treatment? Are there issues with access to care? What are some of the issues with research? And so the cool thing that I like about it is that it will really, I believe, make an impact in our understanding of MS in the Black population. And it's been in the works for 3 years. And I'm just so excited to finally see it come to fruition. So we would love to have as many people sign up as possible. And then the other cool part is that there will be information that will be provided back. So we want to make sure that people know what's happening with the information they provide, and that we also provide education in return, and don't just take your information and disappear with it. So I'd love to have you guys check that out. And so that's really exciting news. And then next slide. Last super exciting news on the first minority-focused MS clinical trial. Yay! So the Chime Study is a phase 4 study that just started enrolling a couple of months ago, where we're looking at people who are taking Ocrevus, a medicine already approved for MS, but the trial is specifically for Black people and Hispanic Latino patients with MS here in the US. And so we've got, I think, about 5 or 6 people enrolled already, and are really, really excited about this trial because we'll again be able to look at clinical information, learn more about the course of MS in the Black population and in the Hispanic Latino population. And then also we'll even learn something about some of the biology that may help us to answer that question about how much is biology that's different, that's causing some of the worst outcomes, versus how much may be social determinants of health and access to care. And finally, last slide, hope. This is the thought that I really want to leave you all with. The MS community and the treatments for MS have come a very long way. In my career, which I'm a little older than I look, but at the start of my career, we only had a handful of options, and we used to have a whole lot more people in wheelchairs in our waiting rooms than we do now. So the treatment is developing at a crazy, fast, amazing rate. And I'm very hopeful that we will soon find treatments that may potentially reverse the effects of MS. And hopefully we're looking forward to finding a cure. So I just want to make sure that everybody knows that even though we see some of these differences and changes in the Black population, not every Black person with MS has a severe course of disease. And we have more effective treatments, but we need to make sure that when people are having symptoms, they're getting to the doctor early and getting treatment and initiating treatment early. So I want to make sure that we recognize that there is a lot of hope. That we've come a long way. We have a long way to go, but there are a lot of us that are working really hard to understand MS and to make sure that we're treating people appropriately. And last slide. Follow me on social media. I am the Nerdy Neurologist. I am Dr. Mitzi Joy Williams, your board certified neurologist and MS specialist, and I am so, so glad to have been invited to do this talk with you all. And I am so excited about the rest of the summit. I know you guys are going to have an amazing time. So if you follow me on social media, stay connected. I'm the Nerdy Neurologist on Facebook and Instagram. I'm on Twitter, and I have a YouTube channel.